Hello everyone, welcome to this pre-recorded webinar regarding the NHS smoking cessation service for community pharmacies across Croydon. We are happy to be here with you today with the presence of my colleagues David from LPC and Yusuf from the Commissioning Support Unit. We will walk you through the whole slides regarding the service and how to implement it. But before we begin, I just wanted to mention that NHS trusts across the Southwest London, they are all actively in process of setting up the platforms to start implementing the NHS Community Pharmacy Smoking Cessation Service, which we will call it SCS from now. Within Southwest London, Croydon University Hospital is among one of the first trusts who want to go live with referring patients to the community pharmacies and benefit from the SCS. So within this slide set, we will provide you with an overview of this of the service and how to deliver it and how to implement it. And in the end, we will have some useful resources and links for you, and of course send you out the slides themselves. So what we will have a look at would be the service background and overview on different available stop smoking services, how to implement the national SCS one, which is our focus for today, what are the IT solutions in terms of data transfer, and in the end, we will provide you with the useful resources and links and who to contact in terms you need anyone to support. So over to you, Yusuf, for the service background.
Thank you, Nisha. Hi, everyone. My name's Yusuf. I'm one of the pharmacists that works for the Midlands and Lancashire Commissioning Support Unit. So what I'll do is I'll start off by giving you a bit of background about the service, where it's come from, and what mine and the CSU's role is. So if we start with the long-term plan states that by the end of the financial year 23-24, all patients that are admitted into hospital, they need to be offered some sort of NHS-funded tobacco treatment service. Now, in order to help achieve that, a lot of trusts are adopting the Ottawa model to provide smoking cessation support. Now, the Ottawa model, it's got various different components. So it's got things such as identifying the smoking status of all admitted patients, followed by giving them brief advice, bedside counselling, NRT. But it's this last part, this follow-up after discharge. This is the key bit about the Ottawa model. So the question arises is that how do we ensure patients, once they've been discharged back from hospital, how do we ensure that they continue to receive this level of support with their smoking cessation treatment? If we could go to the next slide, please. So NHS England decided let's use community pharmacies to help support this part of the NHS long-term plan, and for community pharmacy to become a nationally available choice for patients to access smoking cessation support post-discharge. If we go to the next slide, please. So my role and the CSU's role is to work with trusts and to help facilitate trust uptake in the service, and then continuing to provide support for up to 12 weeks after they go live. We've done this by working in various different stages, but the key ones are that we start off by scoping and mapping all the key stakeholders that we need to be speaking to, understanding the exact position of each trust in terms of their delivery of the long-term plan, and then identifying the key stakeholders that we need to take to working groups, and then providing any information, documentation, any material, sharing all the resources that need to be shared with each working group. So that's it from me. Thank you.
Thank you so much, Yusuf, for your support and providing all this useful information. Now we are moving to the next part, which is an overview on available stop smoking services. And David from the LPC would kindly walk us through different parts of this session. Over to you, David.
Can I just begin by saying just very grateful to Yusuf for all the excellent work he's doing with the actual sort of stop smoking service and supporting us, and the support from the ICS as well. If we can go to the next slide, please, Nashat.
Sure.
So we have actually two services, and I understand there may have been some local confusion in Croydon when we started the calls for the SCS service. This webinar is focusing on standing all of you up to deliver the smoking cessation service under the National Contractual Framework, which is an advanced service, and you're paid through the BSA using MYS. There is another service which exists, and each local authority has commissioned their local stop smoking service. And some pharmacies will be delivering both or possibly one, but we want to make sure that both of these services complement each other. So there may be some experience from the local authority service. And can I just say, on behalf of the LPC, we will be working with local authorities to make sure pharmacies maximize the service and also do well. If we can go to the next slide, please. So there are benefits for community pharmacy with the smoking cessation service. As we've seen, you provide enhanced patient choice. It improves patient access. And again, if you remember through COVID, community pharmacy was the gateway to primary care, the front door to primary care. You kept your doors open. And it's now bringing the community pharmacy network into primary care to provide additional capacity. So there are a lot of benefits. Next slide, please. Right now, there are 30% of all community pharmacies in South West London signed up for the SCS service. We want to increase sign up, and as more acute trusts go live, such as St George's, St Helier, and hopefully Kingston further down the line, we expect that number to grow. So as we go step by step with each acute trust to deploy the SCS service, those green dots are going to get bigger and hopefully delivering this service. Next slide, please. So again, we've just covered this, that all pharmacies provide a local stop smoking service, but the SCS service is under national contract and it complements the existing local authority service. But let's just focus now on the SCS service, and we talk about patients who are in hospital at the moment who've been offered a stop smoking program. And when they're discharged, we want to make sure, and the relationship with Croydon University Hospital and all hospitals are that when the trust refers a patient, discharges a patient back to community, that their stop smoking journey continues to a pharmacy network that's ready to receive patients. And this is very important with our relationships with the hospital. And you are promoting healthy behaviours, and there's a lot of evidence to show how community pharmacies are now heavily involved in delivering preventative services, a big area for community pharmacy. So a patient who starts the stop smoking journey in hospital will be referred to various providers, including community pharmacy. The patient can choose which pharmacy they can go to who's signed up to provide the stop smoking service. And as you normally do, you would meet with the patient or do a phone consultation and carry the program for up to 12 weeks with the patient. The hospital would have initiated the patient on nicotine replacement therapy, and then you would then review that, adjust it as you normally would over the counter or say through the local authority service, and hopefully aim for a quit, which is good news. And the context of this is, you may have all seen the King's speech, where money will be injected into smoking cessation services. So this national service and the local services are very timely, and the LPC wants to make sure that we're fully promoting and maximising what community pharmacy teams can do. Next slide, please.
Thank you so much, David, for all of your support. Fantastic presentation, and also preparing everyone for the part that I'm going to present now, which is the implementation of the SCS within the community pharmacies, which starts from the trust. And thank you for giving the brief overview on how the service looks like. So in this section, I'm going to start with the patient pathway and the steps to contacting the patients, consultations, and the post-event messaging. These are all the details that I will add to the comprehensive overview that David already provided. So if you look at the service specification, which we will be providing the link for you at the end of this presentation and send out to you, you will find out that that there is a very comprehensive graph that illustrates the patient pathway from when they are admitted in the hospital, discharged to the community pharmacies, and so on. But just to make it simple and brief, and for those ones of you who have a photographic memory like myself, I have just decided to put it visual in this way. So in the step 1, when the patient is admitted into the hospital, they are identified as a smoker by the Trust Tobacco Dependence team. They will be recruited to this program with their consent. And after that, when the patient is due to be discharged, they will provide the patients with the 2-week NRT supply. And the point is, if, for example, conditions happen that the patient admission in the hospital is prolonged and they are starting their quit journey before hospital discharge, this also needs to be taken into consideration. Because this will be called as the quit date, which is important for pharmacists to consider because the whole duration of this program is 2 weeks. So if the patient has started the quit journey 1 week prior to discharge and has received the support from the hospital 1 week before being discharged, the community pharmacy needs to provide a further 11 weeks of the service to the patient. So the total number of weeks would be 12 weeks. So at the step 3, the patient will choose a local community pharmacy to receive the electronic referral and continue treatment upon discharge from the hospital. And with the patient consent, the data will be transferred to the designated community pharmacy. And at this stage, the transfer of care will happen from the trust to the community pharmacy. When the community pharmacy receives the referral, they have to accept the referral as soon as possible and contact the patient within maximum 5 days after the referral, and then start planning for the initial and interim consultations with the patients. The beauty of it is that both the pharmacists and the pharmacy technicians can now deliver the service, and delivering the service and having the consultations with patient can be either virtual or face-to-face based on the patient convenience. I will talk about all of them in details in the next slides. And at the end, when the whole service is finished, it would be the last step of the program, which should be the week 12. And this is when the post-event messaging is happening, and the community pharmacy needs to report back to the Trust Tobacco Dependence team to let them know what happened to the patient and what the outcome of the consultation was. So if we want to dig down a bit more in each bits of the community pharmacies, the steps of community pharmacy involvement, when it comes to contacting the patients, the community pharmacies should have 3 tries or attempts to contact the patient. And if they cannot contact the patient is not reachable, they should notify the trust that the patient was not contactable despite 3 attempts was made to them. If you are happy, you can make more than 3 calls, but it is not. It will be up to you. But up to 3 attempts is what is recommended. In terms of patient contact, if you were able to contact the patient, but for any reason they decline to be involved with the service, you will also need to make sure that they will receive the alternative smoking cessation services, which are the locally commissioned ones, at any point of time when they want to start the quit journey again. And if the patient wishes to declare the reasons for not continuing the service, you should also keep a record of it in the medical records of the patients. And of course, the Trust Tobacco Dependence team should be informed of it, that the patient has decided not to continue with the service, because this will be also a mandate for them to report back to the NHS England to what happened to the patient. And in terms of having circumstances where the patient might need to change the community pharmacy due to the change in the address or whatever the other reasons, then their data, after taking the patient consent, will be transferred to the new community pharmacy. And once the patient has agreed, all of the data would be forwarded to the new community pharmacy via secure electronic message. And this is also important in terms of the patient consent. You must ensure having it also verbally from the patient in the beginning of the consultation when you want to plan everything with them. In terms of consultations themselves, they include three essential elements. One of them is the CO test. The other one is the behavioral support with their life and choosing healthy lifestyle choices. And the other one, which we have kept talking about it, is supplying them with the NRT supplies. So it is important for the community pharmacies to have the CO monitors available at the hospital, also having the private rooms, consultation rooms, which will ensure to keep patients' privacy. And these are the considerations to have before setting up all the requirements for the consultation. Another thing regarding the NRT supply, what is important for us and what we are looking at is the quit date. And the quit date is when the patient has started receiving the NRT supplies, and this would be notified in the patient records. And based on that quit date, you will decide on the consultations, the initial and also interim consultations with the patients. But also this quit date is important because you will maximum provide the patient with 2 weeks of supply of the NRT at a time. And the whole duration of the program should be 12 weeks, as I mentioned before. So it's important to have this on mind. And of course, when it comes to the outcomes, the referrals and consultations, they should be recorded on the patient medical record. Either it is by NHS mail or pharma outcomes, which we will cover in the upcoming slides. And also they should keep the proper records of patients onto what happened to them. Just also give you a visual overview of what happens during initial consultations and the interim ones. If we start from the quick date, which is on the left side of the slides, this would be considered as the day that the patient is starting the smoking cessation service with the community pharmacy, and sometime between quit date and the week 4, which can be the whole 4 weeks or 3 weeks, depending on when the patient was discharged from the hospital. This is when the contact should be made to the patient and agree on the appointments that will be done with the patient. And at the end of the week 4, the community pharmacy needs to submit a 4-week post-quit date consultation and formal review. And there will be 3 possible outcomes at this stage. Either the patient has had a successful quit and wishes to discharge from the service, or they have had a successful quit and also decide to continue up to the full 12 weeks, or they are having a failed quit attempt and they would be discharged from the service, which is something that happens quite regularly, and you should expect this and do not be disheartened when it happens. You need to make sure to give the patients the details of other alternative supports available in case they want to continue the quit journey later on in the future. And from week 5 to week 11, the patients will have the interim consultations, which would be scheduled based on the agreement between patient and the community pharmacy. And if the community pharmacy is not able to catch up with the patient within 4 weeks, or the patient does not continue with them, the pharmacy needs to try to re-engage with the patient to ensure that they will receive the maximum support. And at the end of the week 12, it is the time for submitting the 12-week post-quit date consultation and formal review with the patients, and the tobacco trust dependency, and also having the post-event messaging. So why post-event messaging is important? one of the reasons is that the NHS trusts are obliged to report back to the NHS England in terms of what happened to the patient, if they are engaged with the service or not, if they are lost somewhere in between the process, or if they were able to successfully complete all of this 12-week program. So they should report back to the NHS England. But it also means that they can have this assurance that the referrals that they are sending to the community pharmacies will be actioned on, and this will create an environment of trust and confidence in the community pharmacy pathway, and which will lead to sending out more patients to the community pharmacies, benefiting from the skills of the community pharmacies, either the pharmacists or the pharmacy technicians, as mentioned before. And at the end, more patients will be benefiting from the service. And just a bit of more dig down, I have just listed here at different stages where the report needs to be made to the tobacco trust dependence team, and also the GP, because GP should also be informed that the patient is involved with the service and what the outcome was. So at all these 4 stages, either when the patient does not want to engage with the service or decides to have engagement with the service, and also at the end of the 4-week or the 28-day outcome or the 12-week or final outcome, all of these stages, the tobacco trust dependents should be informed. And the GP involvement happens when they want to inform them that the patient has engaged with the service, and the final outcome, what happened with the 12-week outcome, that we also mentioned the benefits of it, of this post-event messaging, and how crucial it is to have. Some considerations for the referrals: it is very important to check if the patient has the eligible criteria, which is for in terms of age, it is being 18 or over. So patients below 18 are not recruited to this program. And we have to also make sure that the patients have not previously completed 12 weeks of smoking cessation support. Also, we need to make sure that there are no drug-drug interactions. I have put the link here in terms of the drug interactions with smoking. And at the end, if it happens that you have patients that are using vapes, we can only support the behavioral provide the behavioral support for them, and we cannot give them any vapes due to the lack of availability of the approved list of the vapes, and they are not part of this service. So for the vape patients, they are only receiving the behavioral support. And when it comes to payments and claims, I will ask David to give us a
Thank you, Nesha.
brief.
Thank you very
Thank
much.
you.
Thank you very much. So I think the important thing is there's a lot of information Nesha's very kindly provided. So we will provide the slide deck to you. It's important you go through the pathway to understand what the acute trust has to do as we build relationships with them and what your responsibility is. But as you can see, a lot of detail has gone into this. So we really want to make sure this is a successful service. Now, in terms of payments and claims, as you've seen from Community Pharmacy England updates and from the service specification, you get an upfront payment of £1,000. And some of you may claim this already if you've met the service specification criteria and done the training. You will also get the following: initial consultation fee of £30, an interim consultation fee of £10, and a final consultation fee of £40. So NRTs are provided free of charge, but like any medicine you dispense or supply on the NHS, you are reimbursed in accordance with the drug tariff. And again, Neshat has very kindly done throughout this whole slide deck helpful links, so you can just click and go to the relevant section on that. So your payments, as I mentioned, this is an SCS service under the National Contractual Framework. It goes to the MYS platform via the API module, and the NHS BSA undertake your payments, and they also do post-payment verification. The NHS BSc I used to work with back in my days at London Region have done a lot of work to support contractors, guides for dispensing. They also will be doing post-surveillance of these services just to make sure that all pharmacies are working. So if they see a massive spike in terms of activity, they may follow up just to explain what's happening. So we want to work with the NHS BSA and work with the ICS and the LPC to make sure that any service that's coming through, whether it's SCS, DMS, CPCS, hypertension, contraception, or pharmacy first, that you're doing what you're meant to be doing in line with the service specification, and you do what you do, deliver your services really well to the highest standard and quality. And it's not just yourselves, it'll be the pharmacy teams, your technician and your frontline staff also who can support you. And in terms of payments, and I remember this from my NHS England days, please make sure you submit 1 month after the activity and no later than 3 months. The cutoff date is 3 months. If you submit an activity 3 months afterwards, then you won't get paid. And that's now set. There's no way around this. So please build into your weekly, monthly routines a cutoff date when you're managing your services, and the LPC will support you in this. Can we have the next slide, please, Nishat?
Sure. Thank you.
And I think that's over to you now. Over to you.
Yes. Thank you so much for your comprehensive explanation regarding the payments. I'm sure there will be more questions coming down the line when the service starts going live, and David and myself will be there to support you however we can. And now we are moving to the next part, which is the data transfer and also the IT solutions in this regard. I'm going to talk about the current IT options and specifically about NHS mail referrals, which is the way that the Croydon University Hospital will start with. And later on down the line, they might switch to pharma outcomes as well. But now that they are starting with NHS mail, the focus would be on NHS mail as well. So as you know, the IT solutions need to meet the minimum criteria, minimum digital criteria, which is ensuring to have a safe electronic and referral system. So the data referral should be done via a secure electronic way. And the two most commonly used pathways for this, as mentioned, are NHS mail and the pharma outcomes. And we're going to focus on NHS mail. So what happens when the community pharmacy receives a referral from the trust? Before that happens, the trust needs to have a manual list of all the pharmacies that are live with the smoking cessation, which they now have it, and they know which community pharmacies are signed up to it. And it would be good to provide the updated list from time to time to both the commissioning support unit and the other stakeholders. And it is recommended that the template that they want to use to send out the referrals to be shared with the LPC and the community pharmacies in advance of going live with the service. And since they are sent out by NHS mail, and after sending the referral via NHS mail, there will be no visibility for the trust to see what has happened to the patient. It is recommended that they also put a red receipt on the emails, and there are a minimum data sets to include in the referral form for the community pharmacies, which are shown here, and you can also find them in the Appendix C of the service specification. So they have to put the patient's full name, NHS number, date of birth, gender, address, postcode, the phone numbers, and the quit date is very important, as it will also determine the timelines and the intervals for when the patient should be contacted. The NRT supplies that they were given. Also, it is very important for them to have the pharmacy ODS code and the address and postcode and everything on the template. I will include the Word template of the referrals for you at the end as well. And just it's also important to not to refer to the community pharmacies before the patient is discharged. So as mentioned, I have put the service specification link here, and it is also recommended that the trust would develop a consistent template for all of the referrals and have the same subject. For example, SCS referral from Croydon University Hospital to X community pharmacy, and at the end the community pharmacy pharmacies should keep a PDF copy of the referrals and use them as a part of their formal reporting to the trust at the week 4 and the week 12. And by saying that, I will hand over now to David to provide us with the community pharmacy requirements to provide the SCS. Thank you, David.
Thank you very much, Neshat. Okay, we can have the next slide, please. So training is going to be very important. So again, sorry to be a nag, please go through the service specification and reach out to me if you need to go through anything. But successful training is completed through the NCSCT website, where they have a list of courses. Some of you may have done that already, and if you've done it basically between 6 to 12 months ago and not been active, I suggest you have a refresh and go through it again. And also read the standard treatment program, the SDP, which will support consultations. Now, again, this is not just the pharmacist doing everything. You've got to know, we've got to work with you to think how you can bring in the members of your team. Some of the best stop smoking advisors have been pharmacy technicians or even frontline members of staff. So we've got to look at how we share the love and the workload across your teams, depending on who you have in your pharmacy. And I know each one's going to be different, but please also have a look at the Better Health Quick Smoking page, because as you find patients who may be referred to other services, it could be the case that if they come off this SCS pathway, you may want to refer them locally to different services in the area. So that website will assist you in signposting patients. Next slide, please. There's also additional optional training for pharmacists and pharmacist technicians as well. The Centre for Postgraduate Education, CPPE, has also additional learning modules. And again, Neshat's helpfully provided the link. So you're all experienced providers and contractors. You will know what your training needs are going to be, and you've got various options to follow up as well. But in terms of pharmacy team training, again, to reiterate this, there's going to be a lot of work. We're going to see technicians doing a lot more under skill mix with the leadership of the pharmacist, and I should say, sorry, pharmacy technician, which is the proper term. So think about how you hold a briefing session for your team, and it's for everybody, to explain how a patient will enter the service and we come to you, how the team can support them. So your frontline staff understand the basics, and your technician, you could have a pre-reg, you could have pharmacy dispensers, and locums can support the service. So it's important that you sort of socialize the service within your pharmacy teams. And again, there's the Community Pharmacy England have done a very good briefing for pharmacy teams. And again, once again, Nishat's been wonderful providing the links, so you can just click that and get access to the information. Next slide, please. And again, as I remember from my old contracting days, all pharmacies should have an SOP for these services. So each pharmacy is unique. So you should review it regularly, and if there are any incidents or issues or even best practice, make sure your team are signed up to it. So it's quite clear who does what in the team. And on the days you're not there, think about how the locum will come in and how the service is maintained. But you must notify NHS England that you intend to provide the service by completing the MYS application. That's important because then from an ICS and from an LPC point of view, we know the active signed up network. That's important because then we can share with the Croydon University Hospital which are the active pharmacies delivering this service, because they can then refer with confidence. And the one thing I want you to take away is, yes, there's a lot of information in this handy slide deck which you can read, but it's also how we build our relationship with the acute trust as well. Next slide, please. There's also other guidance we can offer you. So if you want to let local PCN colleagues or GP practices know, there's an email letter template you can download, where the link again has been kindly provided by Nisha. So letting local colleagues know. You may want to let the local authority commissioners know for the local stop smoking service that you're providing the national service, and we'll be working with the local authority in due course as well. And also you should ensure that appropriate staff have access to your electronic referral system, your computer, so you can access your system to check if referrals are being sent in using the premises specific account. And this has been one issue. You need to make sure during the day that at least a few members of staff can access your shared inbox to make sure that you're seeing the activity coming through for the different services. So at least it can be flagged up to the duty pharmacist or the pharmacy technician so they can take action and then receive patients and manage them as well. So that's very important also. Next slide, please. And in terms of promoting the service, it must be for eligible patients, which is in the service specification. The service should not be actively promoted to the public by pharmacy owners. Remember, this is a discharge pathway between the acute trust and the community pharmacy. So that's how patients access this service. They'll be referred from the acute trust. I think the most important thing to do is, once you're active, is making contact with the acute trust and building relationships with them. If a patient presents to the pharmacy without referred, then the best thing is they aren't eligible for the SCS service, but you could refer them onto your local stop smoking service, or even if you offer any other services, you can signpost them as well. But the way a eligible patient enters this service is through the discharge through the hospital team at Croydon. And there's a checklist that's again been kindly provided by Nishat. You can just download that in terms of readiness. So as you raise this service with your team to make sure they can fully support you as a lead pharmacist, there's a checklist you can work with them on so everybody's clear what they're doing. Okay, next slide, please. And Nishat has now very kindly done a useful pull together slide. Nishat, I'll ask you to present that.
Sure. Thank you so much, David, for that. And by reaching out to this part of the slides, we are also coming to the end of our presentation, where I have provided you the useful resources and the links to what you will need to know about the service, and also the contact information for any needed support.
Mm-hmm.
These are all the links that have been used for developing these slides, and I am putting them all in one place for your ease of reference. We have the link to the website of Community Pharmacy England for the SCS, the national SCS dashboard. There's a beautiful one which is also showing how the service is implemented nationally across the whole UK. We have the service specification, the FAQs for SCS. We have the list of approved NRT product reference list, and also the link to NYS in case there are more colleagues who would want to register to the service and be signed up to the delivering the SCS. Also, the service implementation checklist for the community pharmacies, some useful videos to find out more about the service, and the later, the older pilots that have been done in the early days of the smoking cessation service launch back in November 2020, and also the link to the NCSCT for you for the trainings and everything that you might need in terms of the community pharmacy readiness with regards to the training. Also additional learning links and what would be the GP letter template for communicating with them. And at the end, I have put the contact information of people within both the whole ICB, the trust, the LPC, whom you can contact with. Dina Thacker is the community pharmacy clinical lead in Southwest London, and who would be supporting with all of community pharmacy services, including SCS. We have Amit Patel, who is the CEO of local community pharmacy, the local pharmaceutical committee, the LPC, and he has been always helpful and supportive for delivering all of the services. And David, who you all know and has been here for the continuous support and fantastic one. Thank you so much, David, for your support. And it's my pleasure. And finally, Atif Khan, who is the lead specialist health practitioner for smoking cessation at Croydon University Hospital. Atif and his team would be sending out the referrals, and it is good to have their email address so you can contact them at any point of time if you need any further support. And of course, you have been being contacted by myself during this period of time, and you have my phone and email as well. We'll be happy to support you with anything that we have. Thank you for your time.
Just to feedback again to all of you, because I know it's been a sort of a detailed video. Please do read the details and the information, which has been very kindly put together by Nishat. Again, thanks for everybody at the Acute Trust, at the CSU, Yusuf, and to the ICS, and of course to LPC leadership and the committee as well. And we're now handing over to you to now take the service forward, but we'll be here to support you. Thank you very much, everyone.
Thank you, everyone, and goodbye. Good luck.
Goodbye.